Hey everybody, Dr. Michael Highland here with Highland Physical Therapy and Wellness. Sorry I gave you a teaser and I'm a minute late. So, trying to get the right camera angle. It seems like shooting this side of the treatment table works the best lately. So today, welcome to Wellness Wednesday, and I hope everyone's having a great week so far. I know mine's been pretty good. I wanted to show you not just one but two exercises today. So you get two for the price of one, and the price is free, which is the best price, right? Just wanted to share with you a couple of things you can do or you might try for low back pain, particularly if you've already discovered that movement is possible without injuring yourself, and you're looking for relieving positions and so forth. Last week we covered cobra position or a cobra pose with yoga as a way to stretch the low back into spinal extension, and that is a great way to help if you have bulging or even herniated discs. That can actually be really relieving as far as pain, and it's really good to get that range of motion back if you've lost it, particularly after an injury. Today we're going to talk about, I'm going to show you two exercises. We're going to start with double kneaded chest, and we're going to end with a bonus exercise of cat-cow pose. The first is to mainly stretch the low back muscles in that area, because often those muscles can get increased tone and be really tight and uncomfortable after incidents of low back pain. And it could just be a nice stretch for general purposes as well. The second one, the cat-cow pose, is actually a way to do pelvic tilts once you're out of that really early phase of back injury. You don't necessarily want to do quite that much movement at first. So anyway, this is kind of progressing into higher levels of mobility that you can get with these problems. And anybody watching live, just let me know. Sometimes I can't see a name flash up, so just give me a comment, put a little wave in the comments, let me know you're here. So first one, double kneaded chest. It's a really simple stretch, and most of you may have done this at least. Hi Belinda, thanks for watching. Most of you probably, if you've had back pain, you may have tried this kind of instinctively without even knowing it. Well, welcome from Mississippi. I appreciate you watching. So with this one, double kneaded chest, you just want to lie on your back and knees bent. You're going to bend them more anyway, so you might as well. But that bent knee position helps with neutral position on your low back, so it's a more comfortable position and it decompresses the spine. But for the stretch, you're literally just gonna pull the knees up. You can hold back here as well. It doesn't have to be on the chin, but it depends on preference. Some people might have knee pain, so you don't want to necessarily pull too hard here. But you're just gonna pull those knees to your chest. I like to do it out here because I get a little bit more stretch. But you should feel that in the small of your back. Typically, between the, I'll say the tailbone and let's say middle back, depending on how tight things are back there. But this is a stretch where you can just pull and hold, and you can hold it for 30 seconds to a minute, or you can do repetition versions where you're just kind of going into the range and then laying it back down. You can even do it as an active stretch where you're kind of moving it with your arms as you pull up, where you're moving your legs up. So if you're going to hold it 30 seconds to a minute, I'd recommend at least doing, let's say 3 sets of that. If you're going to do repetitions where you're just holding it a second or two at a time, probably, let's start out with 10 or 15 of them. But anyway, particularly you're stretching the big muscles along the low back right in here. Plus you're getting your spine into a little bit more of a flexed or a bent position. You want to be a little cautious of that with disc problems, but if it's not causing extra pain, it's probably not harming anything. But again, this isn't for like right after something happens. This is really for kind of down the road. Last one is cat and cow pose. I'll show you that one really quick. So it's a yoga position, but it's also used a lot in physical therapy for particularly to teach pelvic tilting, because a lot of times for people this is more intuitive than doing it while you're lying on your back. But for this one, you're just going to, and again, you want to do this to the limits of comfort. So if it's bothersome or painful, you don't want to do it. And if there is any pain, you just go up to the threshold of the pain. You don't want to cross over and go through the doorway. So, so the first position is this way. So you're kind of letting the middle sag and looking up. And then for the opposite, which this is the cow position, for the cat position, you're going up, kind of arching your back like a kitty, head down. So you're getting that stretch from the neck down to the pelvis, and then up. So with this one, you can do repetitions, hold it 2 seconds each side, and start out with 10 to 15 repetitions at the minimum, just to get that spinal mobility back in there. This is great for stiffness, but it's also good as a way to get the spine itself moving, particularly if you have any problems with, I mean, it really could be a variety of things. If it's not a fresh disc injury or herniation, a bulging disc, you could probably do this with no problem. If there's any arthritis in the spine, that could be helpful, just to keep those joints fluid and flexible. When I say fluid, I mean keeping the joint fluid being refreshed and so forth. Just a variety of different issues that could help for. With spinal stenosis and some other conditions, we just want to be cautious about not pushing those stretches. With the knee to chest we showed, that would be a great one for stenosis, because a lot of times bending forward opens up those areas, the openings where the passages where the nerves come out of the spinal cord and exit the back to go down into the leg and the pelvic area in the leg. That could be helpful for that condition in particular. The cat and cow pose, just have to do it with whatever range of motion works without increased pain. But early on it could be helpful for sure. Because with spinal stenosis and some other conditions, you tend to see a reduced flexibility over time. It just kind of progresses. So anyway, I hope that's helpful, and I appreciate those of you who watched. It looked like we had up to 4 people at one moment here. 2 of you still sticking around. Way to go, team. I would really appreciate it if you'd share the video with other people, and especially if you know anybody that has problems and they would want to try something new that they haven't tried for their back problems. And of course they can contact me if they have questions. But yeah, please like and share the video. Really would appreciate that. And other than that, I hope everyone's having a great week. I will plan on seeing everybody next week for Wellness Wednesday. Have a great rest of your day, and as always, be empowered. And you're very welcome, Belinda. Thank you so much.